Hi. All right. So, they switched out my antibiotic. For those who don't know, I was diagnosed in 2020 with stage 4 breast cancer, and I've been responding really, really well to targeted therapy, which is Ibrance, and I'll leave the link below if you want to know more about that. Then I had wanted a breast reduction surgery, and because my blood work was consistently doing really well for the last few years on Ibrance and Letrozole and Lupron, uh, my physician's assistant in oncology and I spent a few years. I dropped 50 pounds in preparation for this, but we discussed how we would how it could be done where I would get my breast reduction because I had a lot of excess breast tissue and I wanted some relief for back pain and to help me lose more weight and so forth. So a plan was made to take me off of Ibrance, which we did in August, 2 months ago. And I would remain on Lupron and Letrozole to control my hormones because my breast cancer is ER positive, so it responds to estrogen hormone therapy. So the idea is to starve the cancer of estrogen. So we did that, and I continued on my daily dose of Letrozole and my monthly injection of Lupron. All right, so then August 23rd, I had surgery to remove breast tissue. They took approximately 2.5 pounds from each side. So 2.5, so like 5 pounds total. And then sent me home in a vacuum pack kind of thing that eventually started pumping blood, which it's not supposed to do. So that had to be removed early. That began a really slow process of healing where the wounds underneath, there's a T, like, there's a scar that forms a T. So it goes up like about halfway up the breast, and then also underneath the breast there's a scar, and that's on both sides. Where those two scars meet is this little intersection where it didn't want to close. So that took a long time, and that continued draining. And changing bandages out about every 12 hours. So then last week, you know, with my left side seemed completely closed and was doing fine, but the right side started getting very sore and very warm. It's been warm on and off since the surgery. My white blood cell count has been pretty high since the surgery. And suddenly it started to harden. It swelled up about twice the size of this side. So this side stayed normal, but this side over here, my right side, doubled in size approximately. It got very hard, got very sore, got very bruised. And they, when I described it to the nurse over the phone, the breast clinic nurse where I got the surgery, she seemed to think that it was blood, maybe, that was dried blood in there, to put heat on it, and to get back to them on Monday. I called a couple of times last week, and that seemed to be what they thought it was. Over the weekend, it got even bigger, it got even more bruised, and it started to change from red to purple. And I sent in a photo and called their emergency line, and he said, I can't really access the photo until I get there in the morning. And I said, well then, I'm gonna need an ultrasound, if not a mammogram. I was totally worried that it was another tumor. It must have been at least softball sized. The mass of it because it was so hard. And then that weekend, I kind of went through what I would consider to be like fever dreams, where I was sleeping a lot and the blur between being awake and being asleep was really off. Like, I don't think I was right in my head. Come Monday, they took out almost 300 cc's of fluid with a syringe before they ditched the syringe and took to a blade and cut, and then had me return, basically did the same thing. And then this time left in a tube. So I have a drainage tube in on this side. A lot of the swelling has gone down. They had to switch out my antibiotic because they'd given me a different, it turned out it's a staph infection. I go back on Monday again to, I don't know what else they're going to do for it. I'm scared. I'm a little frustrated because I just want to be healed. This has been over 2 months now. Next month is my wedding anniversary. You know, I just want to move on with my life. I bought shirts for this. And now because of this drainage and stuff, I've ruined one of my new bras. You know, like, I suppose that's a very minimal thing considering a staph infection is a pretty serious, I guess it's a pretty serious thing. So, I'm getting rest again. I'm back to really tired again. I asked if this is something I did wrong, and they said, no, this isn't anything that I would have done wrong. Although it's very, very strange that something like this would be happening 2 months. This would be something you would expect like right out of surgery rather than 2 months after surgery. But again, those holes were having trouble closing, and I've been changing out, I mean, walking around with like open wounds for 2 months. And plus then I also heard there's a doctor that has, I'll leave a link again. Dr. Liz has YouTube videos, and I was watching her Letrozole and Anastrozole video, and she had mentioned that on hormone blockers, sometimes healing slows down that way too. So I need to ask about that, I think. But I did just have my Lupron shot this week. So I'm a little bit nervous about, I don't know. I don't know why this is taking so long for me to heal from. I'm normally try to be very upbeat kind of person. I try not to live in a fear space in my head. I try not to let anxiety be my default. But now I've been off of Ibrance for 2 months. Over 2 months now. It's been almost 2.5 months. I don't like that because that's my targeted therapy to help fight my stage 4 cancer. It would be so on brand if this is the thing that really makes me sick. And I feel like I am very sick. I feel like the antibiotics are helping, but I was sick. And that was really scary how fast that went. And I know that these things, like you can go septic or whatever. And I'm not a doctor. I don't even understand what all that means. But I'm getting kind of nervous now. Like I said, I don't want to dwell in that nervousness. But I went through, and I think part of this is because of the fever. I went through a really bad depressive phase, a depressive episode for probably a few days. And that got really, for me personally, that got very personally, quietly, privately, very severe. And that could have easily become a crisis. Thankfully, I'm still on my antidepressant, but because of the pharmaceutical situation where like many pharmacies have closed locally, I didn't have access to my antidepressant over the weekend. I didn't have access to a lot of things over the weekend, and it was really, really rough. and I felt like I had just met one of those moments where you're like, I don't know how many times I can come back from something like this again. But I did, and I am, and I'm coming back. It's just that I think that if we don't talk sometimes about those feelings, if we don't admit that that's, you know, that's part of the thought process of being sick. Exhaustion and depression go very hand in hand, and depression and anxiety as well. So when you're not feeling 100% physically, it's very common for depression or anxiety to rear up and sort of start to take over. The thinking isn't quite clear. And I had all kinds of crazy thoughts going on in my head of like, I thought my marriage was falling apart. I thought I was ruining things. I thought I was a big burden. Those kinds of thoughts that didn't, now looking back, they barely even make sense. Those thoughts weren't coming from a logical place. I was sick, and I wasn't really working with a full, it wasn't a good time to be making any major decisions, is what I'm trying to say. And it's okay to admit that when you're sick, that right now is not the time to be trying to decide any major, you know, that I was sick and I needed to get better. I needed an antibiotic. I needed to recover. They had to put a rush on my antibiotic because all these different pharmacy closures in the area meant that they were filling scripts really slow. Well, they were filling scripts not slowly, but they just had so many to fill. And so they had to call to rush, you know, push me up in that line so that I was able to get my antibiotic. So anyway, what I know now is I go back to the doctor on Monday. They will probably express more fluid because it's not as hard as it was, but it still feels quite swollen. Not as bad as it was. But they're giving me the weekend with amoxicillin, you know, the strong, because they said anything, if this doesn't work, it's an IV. I'm going to have an IV. So knock on wood, we hope this works. And I'll keep you updated after the weekend. So anyway, thank you for listening if you are still listening, and I really appreciate that so much. And I'll keep you filled in. Like, as I know more, I'll fill you in more. Please have a nice weekend. Be kind to yourself and others, and have a great day. Bye.